After this series of speech, now we are going to end this day, long day, very rich day, and this afternoon, this session 2 in particular, with I'd say, a specific spatial meeting, because it wasn't what was planned at the origin. We should have worked with a Keith assumption, but unfortunately it was unavailable at the last moment. So he proposed us to build a presentation with several participants, which is very original. And there are very, very, very important people involved, from the FAO, OEI, from the WHO and the UNEP. So we are going to get between 30 and 35 minutes of presentation, 5 minutes each, to talk about the development of the Global Plan of Action for One Health, GPAOH. So I'm going to see now if you can connect your cameras, all of you, and your mic. For the introduction, Barbara Haesler from the FAO. Yes, you're connected, great. Then after you, Barbara Alessandrini from OEI. Okay, and Sophie VonDobschuetz from FAO. Bernadette, we already saw you a moment ago from WHO, and Jeffrey Lejeune from FAO, Valsson Olafur for OEI, and to finish, Cristina Zucca from UNEP. So now, Barbara Haesler, I let you introduce this session.
Well, thank you so much. Good afternoon, everybody. It is our great pleasure to be here today and have the opportunity to talk to you about the Global Plan of Action for One Health that we are developing. My name is Barbara Haesler, and I'm a Science and Evidence Lead at the FAO. And I will cover the introduction of this presentation and then hand over to my colleagues who will talk about the different action tracks that we have in the Global Plan of Action for One Health. FAO, OEI, WHO, and UNEP, with support from the One Health High-Level Expert Panel, OLEP, are developing jointly the Global Plan of Action for One Health. While we are 7 people here today presenting, I would like to point out that this is really a big collaborative effort among the 4 organizations. There are about 40 people who have been working very actively on this over the past months, and with actively, I mean every week with loads of meetings and lots of work on this. But then there are also many other people from the different organizations who have been giving input, advice, and support throughout. So the 7 of us presenting here today would really like to acknowledge the great contributions that have been made by everybody, and we feel honored to be here and talk about it. So this collective effort is currently led by the FAO as the current chair of the tripartite, who also holds the coordination team of the Global Plan of Action for One Health. But each organization has been involved at all the stages, with multiple subgroups formed for distinct activities that ranged from conceptualization, the drafting of the text, development of a theory of change, but also multiple stages of reviewing, revising, and providing particular technical inputs. We are now at an advanced stage in terms of the technical content of this Global Plan of Action for One Health, and we will share with you today an overview of what we are proposing in it in terms of aim, scopes, and the different action tracks that my colleagues will talk about. In the next step, the document will then also go into a consultation process that will be followed by revisions and presentation at the tripartite annual executive meeting, and eventually we will move towards the launch of this. In the past years, we have seen increasing momentum in One Health. While One Health has been in the international agenda for quite a while, the COVID-19 pandemic has clearly reiterated the importance of One Health. It stimulated further the already increasing political commitment and international support for One Health. For example, recent calls to action and the UN Food Systems Summit underlined the need for collective action and coalition building at all levels. We are developing the Global Plan of Action for One Health following the 27th tripartite annual executive meeting that took place in February 2021, when it was decided to develop a joint vision on One Health implementation, intersectoral collaboration, political will, and linked to resource mobilization. To support these One Health cross-sectoral collaboration, the tripartite and UNEP also established a One Health high-level expert panel, which has an advisory role to the 4 organizations on One Health matters in relation to evidence-based scientific and policy advice. Also, the World Health Assembly resolution encouraged the further strengthening of the existing cooperation among the 4 organizations and encouraged to develop options for One Health, including the establishment of a common strategy on One Health with a joint work plan to improve prevention, monitoring, detection, control, and containment of zoonotic disease outbreaks. The Global Plan of Action for One Health will hopefully also help to contribute to the acceleration of One Health, including in various multilateral One Health initiatives. We see an increasing number of multidimensional health, water, food security, biodiversity challenges worldwide, and I'm sure during this meeting you have already talked a lot about these different challenges that we are facing on this planet that necessitate that we think about One Health collaboration, coordination, communication, and capacity building. Given the pressing need to work together for the benefit of the health of people, animals, plants, and the environment, FAO, OEI, WHO, and UNEP have really an opportunity here to stand together as a global coalition to drive change jointly and achieve transformations that are required to mitigate the impact of these current and future health challenges at multiple levels. We really would like to strengthen a comprehensive One Health and to foster change pathways that we need for the successful mainstreaming of One Health at all levels, and thereby reduce the risks to the health of people, animals, plants, and the environment. In our Global Plan of Action, we are including a framework with a joint vision and commitment for collective and coordinated action, which is oriented towards countries to support the establishment of national priorities and activities for One Health. And we are also including support for resource mobilization. We have developed a theory of change for to support the Global Plan of Action on One Health, which you can see here. Ultimately, we would like to have a world better able to prevent, predict, detect, and respond to health threats, and improve human, animal, and ecosystem health while contributing to sustainable development. And to achieve that, we have defined collectively long-term outcomes for a time frame of about 10 years, where we are looking at 2 main streams. One is the improved health of people, animals, and the environment, while identifying sustainable system-wide One Health solutions that allow our ecosystems to thrive in harmony. And the other one relates more to the threats that are occurring at the human-animal environment interface, and we would like to use the One Health approach there efficiently, effectively, and equitably. So in the GPA One Health, and also the theory of change, and also the activities that you will hear about, we are really trying to focus on these 2 main outcomes. And further down in the slide, you see which are the shorter term or medium term outcomes that we foresee for the duration of the Global Plan of Action for One Health, which is for the next 5 years, hoping to start this year, so from 2022 to 2026. And for the duration of this time period, we would like to focus on the outcomes that you see listed here, which refer to the coordination, communication, and alignment of One Health activities, but also the collaboration between the 4 organizations, and also capacity building across sectors, and then also the availability of improved and harmonized One Health tools, technologies, and practices that can help us with the One Health efforts that we are talking about. We have defined 3 pathways of change to achieve these outcomes. And for these pathways of change, we have different activities that we see in the action tracks that we are going to talk about now. So with that, I would like to hand over to my colleague, Barbara Alessandrini, who will first talk about Action Track 1.
Thank you very much, Barbara. I'm Barbara Alessandrini, and I participated in this challenging and stimulating work representing the OEI team. So the action track number 1 is an overarching and cross-cutting action, and we can go directly to the next slide, Barbara, please. And it impacts also on all the other ones, and it aims at developing and building frameworks for collaborative capacities, One Health capacities, or multi-sectoral cross-cutting capacities to strengthen health systems and also promote healthy ecosystems. And we have designed this action thinking that what was needed to develop these capacities through guidance, methodologies, tools, mechanisms, with the purpose to assure effective implementation and multi-sectoral approaches in place to achieve the overarching objective, and also to prevent and manage risks at the human-animal environment interface. So promoting health and preventing risks at the same time. Next, please. Why is this action track important for One Health operationalization, for One Health implementation? Well, we do need multi-sectoral coordination mechanisms. We do need to provide rules and frameworks for interdisciplinarity. And this is what is necessary to make a health system stronger and more efficient and resilient. One Health coordination needs appropriate regulatory frameworks, and we also need to dismantle the existing barriers. We need to stop working in silos, for example. And the mechanisms that should support the implementation of a holistic, completely new approach need to consider complexity, ambiguity, needs to be to deal with negotiating trade-off, and also needs to identify win-win solutions for all the sectors interacting. And we also need rules, framework, mechanisms, tools to agree on priorities, to fundraise, and to build collective and collaborative actions to be implemented. Last but not least, synergies needs policies and regulatory frameworks, and needs to consider the impact they have, need to recognize roles and responsibilities for the engaged stakeholders, and set up rules and obligations in order to be effectively implemented. Next, please. To have a look at the action track number 1 in very few words, this action is made of 3 main components. One is dedicated to the foundation for the One Health capacities. One is dedicated to One Health at work, to capacity building, and one dedicated to define and implement enabling environment and enabling environment. So the first action, is mainly dedicated to provide mechanisms and solutions for need assessment, for system thinking, to design opportunities for joint and common planning, and to agree on prioritization mechanisms, while the capacity building action is, of course, mainly dedicated to workforce, but also to resource identification and effective utilization, mechanisms and tools to strengthen health systems through workforce and through the other resources needed. This action builds and develops new programs and new initiatives, but also founds on a number of successful programs already in place. The last action is dedicated, as I said, to the enabling environment, and so it sets rules for monitoring and implementation, for enforcement, but also for defining mechanisms for sustainable financing. And it also considers enabling factor, the development of transparency mechanisms, communication initiatives, and information systems. As examples of existing programs that can support and that will support the Action Track 1 implementation, and we can go to my last slide, please. that I have decided to bring to your attention today are three. The first one is the National Bridging Workshops. That are workshops that bring together public health and veterinary public health authorities. It is a WHO, OEI, and now also FAO initiative. And in these workshops, starting from a gap analysis, competent authorities build joint plans and roadmaps. I cannot avoid to mention the PVS Pathway Program, which is the flagship program of the OEI to evaluate the critical competencies of veterinary services and promoting tools to develop in-depth gap analysis, strategic planning, and support to improve the level of achievement. This is a program that we consider fundamental to support the strengthening of health systems due to the robust mechanism in place. And last but not least, I would like to mention the platform, the training platform of the OEI that is named Platform for the Training of Veterinary Services, but not only. It is based in Lejeune, as many of you may know, and it also liaises with the WHO Academy newly established. So it is designed to host One Health learning opportunities for our communities. I think I'll stop here and pass the floor to Sophie for the action track number 2. Thank you.
Thank you, Barbara. Good afternoon, good evening, everybody. My name is Sophie VonDobschuetz, and I'm a veterinary epidemiologist working for FAO's Animal Health Service in our headquarters in Rome, in Italy. And I have the pleasure to present you Action Track 2, which is all around reducing risks from emerging and re-emerging zoonotic epidemics and pandemics. Next slide. So to illustrate Action Track 2, I've chosen a very simplified schematic view of risk pathways for Ebola spillover and spread here on this graph to the right, to give you also a little breather from our COVID-19 dominated world, because this shows clearly why Action Track 2 is important and what we want to address. So obviously, in order to better understand the drivers of emergence, spillover, and spread of zoonotic pathogens, we have to do a lot of research, and this is what we've summarized in our action number 1. Then with this information, we can identify and prioritize targeted evidence-based upstream interventions for the prevention of such spillover and spread of diseases. And this is incorporated in our Action 2. And Action 3 is about strengthening national, regional, and global One Health surveillance, early warning, and response systems. So basically, we are moving in a logical way from understanding all the issues around emergence and spillover of pathogens to targeted and evidence-based risk mitigation measures that are acceptable and sustainable. And obviously, what is also important is to have these early warning systems in place so that we can go in there timely with our action and response. Next slide. To illustrate a little bit what is included in the action number 1, which is about the drivers and the risk factors. So first of all, they need to be identified, and obviously not only the immediate risk factors you would think about, like, you know, contact of humans with infected animal species or their products, but we're going even further upstream to look at drivers like climate change or climatic risk factors, drivers that relate to land use changes, for example, that might give opportunities for pathogens to spill over from wildlife, either to livestock or to humans, and so on. So this is a huge work that needs to be undertaken to catalog and characterize all these risk factors and drivers. Then we would define the baselines. So what's the status quo, let's say, to be able to monitor future changes. And for this, we would help establishing monitoring frameworks that would help us also to define triggers, alerting us when something changes and when risks are increasing in certain circumstances. And we will develop standardized protocols, standing operational procedures to encourage and also ensure and harmonized One Health research, so that the data generated by different institutions, entities, or sectors can actually be compared and can be analyzed together in a meaningful way, and therefore enhancing this One Health analysis. We will establish a research agenda with clear priorities and strengthen the science policy interface. Next slide. Under Action 2, which is all about interventions. So first of all, again, we have to identify these feasible interventions that also need to be acceptable and sustainable, raise awareness about risks and how we can decrease risks, and then provide tools and guidance and regulatory frameworks in order to strengthen the uptake and the implementation of these interventions at all levels, actually. There was a strong question to prioritize nature-based solutions. So we aim to do this where possible and appropriate, and incorporating indigenous people's knowledge as well. And we will also establish standards for the management of ecosystem processes. Next slide. Now coming to the One Health surveillance, early warning and response systems that need to be strengthened at all levels, national, regional and global. We will work on conducting One Health surveillance and providing guidance and frameworks for this. Important is also to predict risk factor occurrence and abundance. So I mentioned the monitoring, but we would even like to go a step further and try to predict occurrence for very early warning. Identification of high-risk interfaces and hotspots so that we can target our surveillance systems to where they're most needed. And then performing One Health or pandemic risk assessment and data sharing. And obviously the interlinkages between databases maintained by different sectors is very important here, and the sharing, the timely sharing of this information. We will also provide guidance on progressive control or management pathways in order to address these emerging and re-emerging threats. And innovations and new technologies will be considered. Actually, this is probably an overarching theme for not only for Action Track 2, but for the whole GPA One Health. Next slide. I want to close with some examples also for Action Track 2. Then obviously we don't start from scratch. There are a lot of activities and initiatives already starting and out there that we are directly linking to with our work. For example, I'm starting now on the right-hand side, upper right-hand side, and go counterclockwise. So we have the One Health high-level expert panel, which is currently working on guidance for the design of One Health surveillance systems. That's fantastic, and this is guidance that will be taken up by the GPA One Health as well. The tripartite has developed a surveillance and information sharing operational tool, the SISOT, which is currently in the finalizing phase and will be published soon. And this is obviously a great tool for countries to use for this data sharing, cross-sectoral data sharing. WHO recently inaugurated the One Health Intelligence Hub in Berlin. So obviously an important initiative to link to. And we have the One Health Intelligence Scoping Study under the G7 that FAO is leading, but where we have all our partners partnering and helping to implement. So this will also give us a lot of insight on the status quo in terms of One Health intelligence and the gaps and how we need to plan our next steps. And with this, I will hand over to Katrin Bote for Action Track 3.
Thank you very much. So, as you can see, I'm not Bernadella Abilarida, who leads this action track, but I'm Katrin Bote, a technical officer at the WHO Neglected Tropical Disease Department, and I'm working together with Bernadette. So I have the chance now to give you a brief overview of the action track 3. We have heard about the epidemic and pandemic diseases just from Sophie, and especially in developed countries, the focus lies very much on those diseases. If we go to the next slide, please. Thank you. So in comparison to the epidemic diseases, there's usually only little attention for the more ancient and endemic diseases, as these diseases affect almost always those with little political influence or little resources, like, for example, poor livestock keepers in rural areas. Therefore, these diseases are also considered diseases of poverty. They are a heterogeneous set of viral, bacterial, and parasitical diseases with life cycles including human, animal, and environmental components, like, for example, rabies, echinococcosis, or brucellosis. They place a huge burden not only on the health of the marginalized and vulnerable communities, but also have tremendous social and economic impact. So if we go to the next slide. Thank you. We can see the overarching aim of our action track. The aim is to reduce the burden of the endemic, neglected, zoonotic, and vector-borne diseases by supporting countries to include community-centric strategies to tackle these diseases, and also to use the opportunities to integrate the neglected zoonotic disease control activities in already existing programs, as well as to increase the commitment and investment overall for these neglected diseases. So we focus on 3 main actions. If we go to the next slide, you can see our first action. The first action aims to build awareness and demand for control measures for neglected zoonotic diseases and vector-borne diseases, including the communities and the stakeholders across the different sectors. So activities, for example, include awareness raising, communication, ensuring access to vaccines, and working together with water, sanitation, and hygiene services, engaging the communities. It is important to understand the attitudes and the knowledge, especially about the animals and the environment, and what are the drivers and disincentives for program implementation and participation, for example, for farmers, as we heard already today earlier in the talk. On the next slide, if we go, thank you. Action 2 is more based on helping countries to deliver systematic, harmonized, and integrated data collection to improve the knowledge about the burden of these diseases, because they are vastly underreported and under and misdiagnosed. We don't really know what the burden really is. So the countries should be able to collect and report disaggregated data across the sectors, identify the risk groups for the diseases that are present, and also the research gap, and be able to target the actions across the sectors. So the focus here is on the One Health control programs and strategies, as well as also on some legal and policy frameworks. And then we have a third action on the next slide that aims to support a common vision to increase the political commitment and investment in these diseases by, for example, providing evidence and investment cases why we should really commit to control and eliminate them. We want to encourage the countries to take ownership and make use of many already existing strategies. And we hope to remove the barriers to create strong partnerships and networks to lead to sustainable and long-lasting action. So it is unrealistic to achieve eradication of these diseases. So the GPA is now for the next 5 years so that we can start to control and eliminate these diseases effectively. So this was a short overview of the Action Track 3. And I would like now to give the floor to Jeff.
And thank you. I want to talk about food safety hazards in the food chain. And in full disclosure, I have a biased opinion. I am a veterinarian, but I think One Health is often should be very food safety centric. It plays a critical role. My colleagues both at OEI, WHO, and UNEP have contributed to this presentation and the focus that we'll talk to you briefly about. Please, the next slide. The need for a One Health approach is evident. The burden of foodborne illnesses, 600 million cases a year around the globe. That's 1 in 10 people every year falling ill. The daily life years lost, 33 million, 420,000 deaths. And the burden is also disproportionate, really affecting children and also affecting those that are in low and middle income countries. Now, these diseases could be caused by physical contaminants in the food, chemical contaminants in food, or the biological ones. And the biological ones actually include some of the diseases that we've already mentioned, emerging diseases that could be transmitted via food, endemic or neglected diseases transmitted through food. And as you'll hear in the next action track, many of the diseases that are foodborne diseases that are being transmitted are becoming more and more resistant to antimicrobials. So it kind of covers many of these areas that we're talking about in this program. So let's move to the next slide. And the reason that we need a One Health approach, and I don't expect you to be able to see all the things on this slide, the idea is food systems are complex, okay? And being so complex, there's no single organization or team that can answer all the questions within the food system to solve all the problems, okay? The other thing that's unique about food systems is that they don't necessarily obey the Newtonian second law of motion, where you have a reaction and action in one with an equal and opposite reaction. No, it's not like that. A small impact in one area of the system can result in massive contamination because of cross-contamination, pathogen growth, and trade around the globe. So a small impact can actually end up with a big result. Flipping that on the side, though, if we think about it, a small impact to intervention to improve food safety could also even have a larger impact at the end of the line where we prevent it a whole lot more. So that the prevention preventing a fire is far easier than fighting one. So if we can intervene upstream, this is great. The last point I want to make about this in this system is that food safety affects us all, okay? I don't have very much contact with wild animals and bats and things like that living in the city here. I see my dog, but everyone, hopefully everyone has the opportunity to eat each day. And to really underscore that connection between our food and the environment, the best definition I could find was published in a book several years ago. And if you go to the next slide, a veterinarian and the University of Guelph published Food, Sex, and Salmonella. And the idea that eating is an essential pleasure, but it's also very intimate. We're selecting portions of our environment and putting them directly in our mouth. And as the author states here, we need to be careful which partners we choose to interact with. And if we can make those interactions safer, then we can have a healthier planet, healthier people, healthier animals. So to give you an example of what we're going to do to achieve this goal, we can go to the next slide. And we have several different objectives and activities, but they really fall under these 3 components of risk analysis: risk assessment, risk management, and risk communication. And these aren't necessarily something new, but they are missing in a lot of places around this globe, and they need to be strengthened around the globe. And when the strengthening of these activities, we need to be sure that a One Health lens is taken. So we don't focus only on the actions related to food safety, but what would those activities or interventions mean to the health of animals, or the welfare of animals, or the contamination of the environment, okay? So you can read kind of the ideas of what we need to do, providing guidances to manage risk, understanding what those risks are, which would include increasing the surveillance and integrated surveillance, integrating surveillance systems with environmental surveillance, diseases in humans and diseases in animals. So this is kind of the approach. And the last slide I would like to do is share with you some of the examples of how this looks in action. So there's two activities that we're really working on at WHO and FAO simultaneously. FAO has a strategy for improving food safety globally, which we'll be launching soon. I guess we're in the 2022 now, this year it will come out. At the same time, WHO has been working on their global strategy for food safety, which will come out. And in both of these strategies, we've been asked by our members to collaborate and coordinate with the other organizations. At the same time, OEI and UNEP play important roles in food safety. Maybe not as large on the outside view, but we can see that there's certain things, for example, pollution in the sea and the soil with metals or microplastics. It was just last week, maybe 2 weeks ago, we had an expert meeting on microplastics in food and had participants from other organizations coming in to contribute to that, determining what the risks were, and then eventually being able to propose some risk management options. Related to OEI, for example, we have drug residues, keeping animals healthy, but keeping the residues out of the food so that people aren't affected by those chemical hazards. So that's an overview of the food safety aim for our proposal. And I'll pass off to my colleague Olafur from OEI, please.
Much, Jeff. Well, my name is Olafur Valsson, and I'm from OEI, and I'm the deputy head of the veterinary medicinal products and antimicrobial resistance department, and I'm also a liaison officer to the tripartite and UNEP joint secretariat on AMR. So we have been working together, all the four organizations, on this action track 5, taking, of course, into consideration our year-long collaboration in the field of antimicrobial resistance. We call the action track Curbing the Silent Pandemic of Antimicrobial Resistance, but the aim is really to preserve antimicrobials, the efficacy of it, and also to ensure sustainable and equitable access to antimicrobials for, of course, responsible and prudent use in human, animal, and plant health, and also to contribute to the Sustainable Development Goals. So, next slide, please. And to do that, we have divided the action track into some sub-actions or actions. I will mention 3 here. And the first one is to strengthen the capacity and knowledge of countries. It is very much country focused, because we believe that the actions, they really need to be at country level where the results are. So to prioritize and implement context-specific collaborative One Health work to control AMR in policies, in legislation, and in practice. So across everything. And some of the activities that we are promoting is to support a balanced and well-functional national interagency coordination mechanism. And also to support One Health approaches to AMR in the national action plans and in the implementation of the national action plans. We have established already a multi-partner trust fund on AMR and are running it before organizations. We are actually managing this multi-partner trust fund. And I will come a little bit back to that later on in giving examples of what we are doing. And then, so ensuring the effective management is really important. And then surveillance is, of course, very important. So guidance for countries on integrated surveillance. So really to have platforms for integrated surveillance where the surveillance data from the different sectors can be collected and can also be compared, because that is quite important. That is both on antimicrobial resistance and antimicrobial use. Next slide, please, Thomas. On the action track 2, that is to reinforce the global and regional initiatives and programs to influence and support One Health responses to AMR. And there it is really important to engage with regional political and economic groups. An example I can give where the tripartite and UNEP are supporting regional advocacy activities is, of course, in the World Antibiotic Awareness Week. Regional activities on the World Antibiotic Awareness Week have been conducted over some years now, and they are, in all cases, all the 4 organizations on regional, on country levels, and at global level are contributing and participating with the regional communities on that. We also highlight that it is important to have standards and technical advice on global best practices. And this is also something that we think is really important. And then, of course, to coordinate the global One Health response to AMR. Next slide, please. The third one is, I will just mention it, it is also to the global part of the AMR response, to strengthen the global AMR governance structures. And there are 3 global governance structures that have been proposed. One of them is already up and running, and probably most of you know of that, and that's the Global Leaders Group on Antimicrobial Resistance. Another one is, the terms of reference have been developed and is awaiting approval of the UN Secretary General, and that's the Independent Panel on Evidence for Action on AMR. And then the third one that is in development is the establishment of and operation of the multi-stakeholder partnership platform. So these 3 are really global governance structures that the tripartite and UNEP Joint Secretariat on AMR is supporting. So just the last slide, just to give you an example of what we are aiming at doing. Strengthening health systems, and I highlight the last S, it's a plural. It's animal health system, it's human health systems, and it's plant health systems, and then the environment. So this is something that is really the core in our belief, because we think prevention is the alpha and omega in the antimicrobial resistance, and that goes across in the One Health. Prevention is really important. To do that, and through the MPTF, Multi-Partner Trust Fund, we are supporting in one low and middle income country vaccination production and campaign. And the reason for that is that in that specific country, 500,000 cattle at least die every year because of tick-borne diseases. We provide support through the MPTF to veterinary services to produce the tyleriosis vaccine. This was a kind of a stopping block in the outreach for the vaccination campaigns. So it was actually by providing this support for the veterinary services to produce the vaccine, we have been able to roll out a vaccination program in that country for tick-borne disease in general. And I mean, we often say, if we link it to the One Health Global Plan of Action, we say prevention. And often this is that prevention is better than cure. And I think we really want to strengthen health systems to prevent. And when it comes to AMR, I mean, we might even be able to say prevention is the cure, because prevention is really what matters. And with that, I give the floor to Cristina.
Thank you. My name is Cristina Zucca. I work on pollution and health in UNEP, and I work on this issue of One Health together with colleagues dealing with biodiversity and ecosystems, climate, food systems, and other related topics. So last but not least, the sixth action track is on integrating the environment into One Health. Of course, environment is part of One Health, so it is part also of the other 5 action tracks. But given a relatively lower attention that the environmental dimension has received in the past, also given emerging understanding also of linkages of environmental factors for health, the drafting team felt that maybe it warrants a dedicated action track, which focuses exactly on looking at how to strengthen environmental dimension in various aspects of One Health. We can move to the next. Thank you. So what is the objective of this action track? The direct objective is to protect and restore biodiversity, prevent the degradation of natural resources and environment, in order to promote the health of people, animals, plants, and ecosystems, and thus underpinning sustainable development. Of course, protecting ecosystems and environment is the foundation for health, and the negative side of the coin is that environmental degradation in every form has direct or indirect negative consequences for health. Perhaps the consequences on human health are more known. Everybody knows probably the figures of air pollution causing 7 million deaths annually. And there are many more scary figures, but actually the impact goes beyond human health, and the interlinkages are many more. So in order to address the risks that derive from this, it's important that the environmental, public health, and animal health sectors, they understand these linkages, they speak with one voice on these linkages and factors, and then they work together on One Health harmonized approaches. Next, please. So in this action track, we have 4 action areas. The first one is to undertake activities, joint activities that can protect, restore, and prevent the degradation of ecosystems and the wider environment. So some examples of activities here are better understanding the linkages and environmental factors that pose health risks, but also directly promoting activities that are more sustainable. For example, in the field of agriculture, aquaculture, and animal husbandry. The next activity is mainstreaming the environment into One Health approach. This means that we need to more strongly integrate the mandates, the priorities, the functions, and the knowledge of environment-related professionals and of the environment sector widely into One Health approaches. Examples of activities of efforts here might include reviewing existing tools that promote intersectoral or multisectoral collaboration, and making sure that the environment is integrated into these tools and approaches. Next, please. Third activity is more focused on knowledge and data and evidence, so that One Health decision making is based on also strong inputs from the environment sector. So there are many sets of data that exist or can be generated that would be useful to inform decision making. But also there are opportunities to have joint or interoperable integrated information systems that bring together environmental and data from the broader health sector. This may also include the possibility to bring information from indigenous people, so traditional knowledge, so not only the typical academic sort of data that can inform decision making, including citizen science. Last but not least, again, the last activity. Sorry, yes, it is about strengthening the capacities of the respective sectors, professionals, and institutions, so as to empower better participation, for example, by environmental professionals into health related activities, decision making, vice versa, and also to empower all the relevant professionals to work together. I will stop here. Thank you.
Thank you very much for all these presentations, and we could really understand with much precision your initiative and the program. So we have, unfortunately, I'm sorry, very, very short time left because we're already very late, 15 minutes late. So I'm just going to ask you one or two questions that we got on the questions window. Jennifer Pradel asks, can one of you give some more information on tools that you are looking at? Tools to do what? Are the tools aiming at facilitating collaborations in general between a variety of stakeholders? Who wants to answer? Very briefly, if possible, please. Nobody?
Barbara, do you want to address this question?
Yes, it relates to the One Health collaborative capacities and the tools, whether there are specific tools that we are going to use to facilitate collaborations in general between a wide variety of stakeholders. And in action track 1, where we think about first looking at what is there, but then addressing these competencies and capacities, and also creating the enabling environment, we do have tools that we want to use, but we also want to keep an open mind to make sure that we have like a menu that can be used according to what is needed in a particular context, because there isn't a one size fits all, because we have so many different environments and different contexts and different demands. So I think we are more thinking about a compilation of different tools that can then be used according to what is needed in the situation and the context that we are looking at.
Okay, thank you. And Pascal Haesler said, great to see this collaborative initiative. Do you have a precise agenda with timelines and concrete deliverables to measure the progress and success of the initiative? Who wants to answer?
I'm happy to start on that and then hand over to Barbara. And I think, Olafur, you had your hand up before, right? Did you want to add to what I was saying?
Well, I was just on tools. I don't know, maybe just to mention briefly that there are, of course, several tools available from the tripartite and UNEP on antimicrobial resistance. But one I can mention is that in development and will be piloted now in a month's time or two, is a legislative assessment tool. So assessing legislation related to antimicrobial resistance across the sectors, across the One Health sphere. So I think that might be a very interesting one that we will see hopefully used quite a lot in the coming years.
Thank you. About the agenda, maybe, Barbara?
Yes, so on the agenda, we do have, for each action track, we have a list of detailed activities under each action. And for each activity, we have defined the time frame within which we would like the activity to happen. We have also suggested who would be suitable collaborators in these activities, and also what you would like to see coming out of these activities. However, these are more general activities, let's say. So these are generally applicable. And then as a next step, we will need to think about implementation, and obviously implementation will come with specific work plans and specific deliverables in relation to these implementation plans, but that will happen at the next stage. And maybe one of my colleagues wants to add to that.
Very quickly.
Okay. Yes.
Yeah, very quickly. This is a 5-year action plan, and as Barbara said, it will be followed by an implementation plan. And what we will have to do will be to use the existing resources and maximize the impact of the existing tools and mechanisms and develop the new ones. So in this 5-year time, let's say that the first and second year will be mainly dedicated to the recognition of what already exists and can work to address the needs of the plan. And we will also need to find financial mechanisms for piloting the new tools that will be developed in some target countries that will have to be identified. So all this planning activity will have to be supported also by a financial activity to support the plan implementation. With reference to the question about the tool and the time for implementation, there are, for sure, we will prioritize the assessment phase, because in the assessment phase, we will need to understand what is needed, what is already existing, best practice to be shared, guidelines and manuals that can support implementation, learning need assessment. So all these things or mechanisms to identify existing funding opportunities and how to implement them at country level. So let's say that the assessing part would be fundamental at the very beginning to plan in detail the tool development, test, and implementation.
Thank you very much for these precisions and for your participation at the last moment. It was nearly improvisation, so thanks a lot, really, for your work. And thank you everyone for participating in this session 2 and this rich day, which is now over. And I propose you to meet tomorrow morning for the second part of the conference, and the session 3, which will be dedicated to tools development. Tomorrow morning, we meet at 9 o'clock, like this morning, to continue working together on One Health. Thank you very much and have a good evening. Thank you. Bye-bye.